The concussion management protocol is at the very beginning of the healthcare provider's toolkit. It is the first document within the reference section, and it is something, even though that's the only toolkit that it's in, it's something that we really want everyone to know about. Doesn't matter what you do or who you are. We want everybody thinking in this way that concussion is a 2-visit minimum diagnosis. So on the first visit, if someone comes into your office and you're a healthcare provider, you're going to evaluate and give patient education. So it says it right there, what you might use, what tools are recommended within the toolkit. So the acute concussion evaluation, that's put out by the CDC. We'll talk more about that in a different video. And using an age-appropriate symptom scale. So the child would get one, an age-appropriate version, and then the parent would get one, or if it's an adult patient, then the adult would fill one out. And we would like one to go home with the parent or the adult patient, so that then over the next 4 weeks, they know what to be looking for. Because often the symptoms after 4 weeks, most of them are going to clear for most people. But they're going to start looking academic or social or behavioral or psychological. So people don't always think to go back to their healthcare provider. So we want them looking at these symptoms and knowing that the healthcare provider is asking them to come back if they experience any of those symptoms. We also, at that first visit, are asking healthcare providers to give some sort of patient education. We are recommending some that are in the toolkit. Again, we'll talk more about those in another video. But we know from the research that patients won't always come back within that first year. So we want to give them information so they know what to do if symptoms persist. And this whole management protocol is geared around filling the gaps that are seen in the literature in diagnosis, identification, treatment management, and referrals and patient education. So at the 4-week point post-injury, we are asking then that the person come back, and if symptoms persist, and that the healthcare provider consider a referral at that point. If their symptoms haven't gone away, then we need to refer them. They may have done it earlier if there were really some significant symptoms, but if they were waiting to see if they were going to go away on their own, then we want at the 4-week mark to not take any more time and to make the referral. And there are some listed here on the concussion management protocol. So things like places like a specialized concussion treatment center, a neurologist, a symptom-specific specialist like a neuro-ophthalmologist, a brain trauma rehabilitation center, neuropsychological evaluation, Tennessee Early Intervention System if the child is under 3 years old, the school district if they're 3 to 5, and the actual school if they are 5 years and over. And at the year mark, we would like the physician, the health primary care provider, to be asking about that concussion. Even if it's not raised by the individual or by the parent, we want that physician, that primary care person to be asking about symptoms, anything different since that concussion, because that gives another opening to look for some of the long-term changes that occur after a concussion, a mild traumatic brain injury, and to make some appropriate referrals. So that is the concussion management protocol, and we would love it for you to be incorporating that into your daily practice.